I'm Kimberly Cochran and I work as a registered nurse for the Mental Health Triage and Emergency Care Support Team, otherwise known as TECS.
Hi, I'm Rose Roberts, Clinical Change Manager for Mental Health, Drug and Alcohol and Project Leader, which we'll get back to soon.
Hi, I'm Katie Marr. I'm one of the clinical nurse specialists at Queanbeyan Emergency Department.
I'm Emily Bunt. I'm a clinical nurse consultant for Seclusion and Restraint Reduction.
And I'm Judith Hum. I'm the Manager of Clinical Redesign for Southern.
So Rose, what is the project and why are we doing it?
Well, look, I'm very pleased to say the project is to do with seclusion and restraint reduction in our 5 declared emergency departments. It's very exciting. It's a joint venture led by Mental Health, Drug and Alcohol, but in very close partnership with our emergency departments around the LHD. Which, Emily, I guess brings us back to you. How does this align with your substantive role?
Yeah, so I'm currently working on a project to reduce the use of seclusion and restraint throughout the LHD, and that includes our acute mental health inpatient units and our declared emergency departments. So we've already seen some success in our mental health inpatient units with a reduction in the use of seclusion and restraint. And this has been brought about by a number of changes, including the introduction of the Safe Wards model, and working very closely with staff and consumers and our consumer and peer workforce as well. So we're really excited to see what changes we can bring about across the district as a whole. Katie, as a CNS in the emergency department, what do you think about the project?
As a clinical nurse specialist in the Queanbeyan ED, I take an active role in improving healthcare delivery systems. I have a particular focus on trying to improve mental health care in the Queanbeyan ED at the moment. I've had years of experience dealing directly with patients that have had to be secluded and restrained, and I've seen the negative effects that it has on those patients. I'm committed to this project because it's recognised that the reduction of seclusion and restraint leads to better clinical outcomes and less trauma for our mental health patients. Kim, working for TECS, what do you see as some benefits from this project?
Well, my experience with TECS with doing the acute mental health referrals and assessments within the ED, as well as my experience in the past of working in the acute inpatient setting, has given me first-hand experience of what impact seclusion and restraint does have on patients and also on staff. And I think that that's, particularly important for me is making a difference in the area, around that, getting better care for our mental health consumers. And also, I think working towards building the partnership between mental health and emergency departments. I think that for a long time, those areas have worked quite isolated from each other, and I think that it's really important for this project that we build those partnerships to support each other better, to get a better care for our patients and consumers. So I think it's important.
That's great, Kim. I'd like to now introduce Judith. Hi, Judith.
Well, I'm the redesign manager, as
Yes.
you will know, and clinical redesign as a methodology was chosen for this project because there are a lot of complexities.
Yes.
And the district feel, and as the sponsor in particular, felt that this needed a real investment of skill and talent across the team. And we know that this will take about 12 months with all of you participating in the graduate certificate, which adds another level of commitment to the project. But I think that redesign, which focuses primarily on improving the patient experience, including staff and consumers, that means the patients and their families, both in identifying what some of the challenges are, but also helping us to design the solutions. And that sort of co-design, that collaborative approach is what redesign is pretty much based on. So I think redesign is very suitable for this project. And I think that the commitment that we will make for a year will mean that we may see some long-standing embedded change in the way we manage seclusion and restraint in emergency departments.
Yeah.
And I think we are lucky to have the team we have that is representative of all aspects of the care provision team.
Yeah.
Rose, just to finish off, I'd like to ask you a question that came out of what I just said. When I think about co-design, I think about that working together, the collaboration, the partnership. What do you think co-design will bring to this project?
It's a good question, and what I'd like to say is that mental health, drug and alcohol has been on this journey for seclusion and restraint now for 10 to 15 years, not just in Southern or New South Wales, but in Australia. And I've been part of that journey. And it's taken us a long time for us to look at our care options and our skills and our training to reduce seclusion and restraint. And we're in that space now. And now with this project, I see us sharing those skills and competencies with the emergency department staff. And coming into their space, we don't know your space, we don't know the emergency department space. We know our space and how it's been successful for us. So we'd like to come and consult with you and collaborate with the emergency departments to see how our skills in caring for consumers to reduce this horrible care intervention for them, to help you do the same thing in the emergency department. So that's how I see the co-design playing out for us.
And does that sit well with you, Emma?
Yeah. So I guess the emergency department is a really stressful environment to work in. It's very chaotic and it's not particularly suited to caring for mental health patients. They often are very confused in that situation. It's a lot of stimulation going on around them. So I think any sort of technique we can use to better care for the mental health patients and reduce aggression and things towards staff as well is very welcome.
Yeah. So just to finish up for us today then, I'd like to hand back to Emily to talk a bit more about the journey and what we think is ahead of us.
Sure. Well, I guess our goal is to reduce the use of seclusion and restraint, ultimately with the move to eliminate these practices, which is gaining momentum nationally and internationally. People are looking to eliminate the use of these practices because they're traumatic for everyone involved. At this point in time, at the beginning stage of our project, we don't know what direction we're actually heading in at the moment. We don't have the solutions, but we're going to be working those out using the redesign methodology along the way. So we're quite excited to see what we're going to come up with and what we can use in these spaces.
Okay,
Great.
And we all look forward to it, and we look forward to keeping you posted as we go along this journey with the EDs and our consumers and our staff.